A new study from researchers at St. Louis University reveals the challenges and the benefits that mothers who breastfed face during the pandemic.
That's right, and I got to speak to researchers there at SLU about the effects of stay-at-home orders on breastfeeding practices and the lasting impacts on families raising children.
It comes at a cost.
Dr. Maria Jose Romo Palafox is talking about breastfeeding. She's an assistant professor of nutrition and dietetics at St. Louis University. She and 3 other researchers published a new study in October called Breastfeeding During COVID-19 Stay-at-Home Orders: Implications for Future Maternal Work Policies and Health Equity. Romo Palafox says 1,800 women were a part of their sample size, with many hours of interviews conducted.
And then we opened at the end, is there anything else you want to share about breastfeeding during the pandemic? And that question is where this study comes from.
Romo Palafox says a lot of women opened up.
People going through health issues through the pandemic. We had people who were really happy that they had time to be with their child.
Through the study, 34% of mothers said stay-at-home orders during the pandemic made it easier for breastfeeding and bonding with their babies, while mothers who identified as women of color did not have the same experience.
Identifying as Black meant that you were at higher risk to say that the pandemic has extremely affected your day-to-day life. And then when we looked at moderately affected, it was more Hispanic women.
The World Health Organization recommends breastfeeding up to 6 months of age. However, in the U.S., only 26% of infants met this recommendation in 2020. Romo Palafox also found that women returning to work was one of the main barriers to people who continued breastfeeding. Plus, women who returned to work had trouble with support from their workplace. She says conducting the research was hard and sometimes disheartening as a Mexican immigrant.
Some of the issues with funding include that our names could be triggering some pushback.
But Romo Palafox says she'll continue to advocate for mothers facing health gaps.
I hope that we have enough voices that are making at least the invisible visible.
And the study is published in the Maternal and Child Health Journal. The team of researchers at SLU says they'll continue to argue that existing policies like the PUMP Act and Pregnant Workers Fairness Act may not adequately meet the needs of low-income, racially diverse mothers.